Okay, the techniques we're going to display now are lumbar PIVVM techniques, and we talked about these in the lecture series. Now, these tests have not been shown on their own to be particularly reliable or valid, but to me they're a very important part of an overall segmental specific lumbar spine examination. Taken together with PAs and with general physiological movement and the results of other biomechanical tests, the provocation tests in the SI joint, the clinical stress tests, I believe they are useful, and there is some research that's been shown to prove that we went through in the lectures. So I'm going to go through flexion, and then we'll do extension and side bending. Now, it's very important in this case that you are in a comfortable position, and also that the patient is in a comfortable, relaxed position also. And we're going to be doing the physiological movements while palpating through the specific segments, and we're looking for an area at this point that just doesn't seem to fit with the rest. So we're not grading each level as opposed to each other level, but rather we're looking for a level that sticks out in relation to the others, one that either moves too much or moves too little in relation to all of the others. We can then use more of our segmentally specific PAs, our other biomechanical tests, also with the stress test, to determine exactly what is moving. So I'll have the patient come as close to me as they can tolerate. Travis will come just a little bit closer. Always use the arm linking technique again, simply because this controls the upper body. Now, you notice that with Travis, as with most males, does not have a large discrepancy between his waist and his hips. So we've got a relatively straight lumbar spine there. In a woman, or especially younger females who tend to have a larger discrepancy between the hips and the waist, it may be important to put something underneath the waist, such as a pillow or a rolled up towel, in order that we maintain a relatively straight and neutral lumbar spine. If the spine goes into side flexion before we even start the technique, then we're biasing our results by taking some of the available movement out. So in this case, we'll palpate just generally here. I'm looking for L5-S1. The iliac crest straight downwards tends to get the L4-5 into space. We can palpate one level down. And then his knees are fitting just into my anterior hip region. There's a nice little spot for them there. I'm going to cup his ankles with my free hand. Now, don't try and do it like this. It gets a little bit too difficult. It's too heavy. But this allows the leg, my thigh, to take most of the weight. The movement here will come through my body movement. I can almost do this without my hands, except the fact that I've just got to bring them up. This should not be a hand-specific technique. This should not be a strength technique. This should be something you're doing through momentum of your body. You can't see my feet here, but my feet are firmly pointing forward. I've got weight through my knees to about 20 to 30 degrees of flexion. I've got a neutral lumbar spine myself, and I also have a very weight-centered approach. My center of gravity is easy to control. I will then palpate the L5-S1 segment, and then I'm gently going to move in very small grades until I feel that segment move. When I feel that segment move, I can come up to L4-5 and L3-4 and L2-3 and then L1-2. And what you can notice about this is that we're not doing big movements at this point. We're doing very small movements at each range just to assess the general range of motion at each segment. It's a fluid movement, and also encourage people not to hang around at one particular level in this manner for a long period of time. This is the point where you really have to start trusting what your hands and your body are telling you about how you're doing these techniques. Let your hands feel what they feel, and then move on, and then move on and move on, all the way up the spine. This will help you to develop the ability to be able to pick out one that doesn't seem to fit with the others, and you can go back and assess that later on. If you stay in there too long and concentrate too much on these and think too much about them, I think you start letting your pre-biases come into play. It's just got to be a straight up and down technique, feeling what you're feeling and letting your hands tell you what you're actually feeling.